Calvin and I we're not only work colleagues, but we parent in the same community. And his kids, his beautiful sons, are always looking out for my daughter. So he's doing a great job, not only in the community, but as a father, which is, as we know, one of the most important jobs you have. Our next panel is something that has been so important to the last year, or continues to be, because we're still in a pandemic, right? We're going to talk about healthcare and the disparities in healthcare. Joining us is Ms. Rosalyn Frazier. She's a chief executive at Broward Community and Family Health. We also have Ms. Faith Simone-Hunte. She is the director of employee relations at Broward Health. We also have Mr. Aurelio Fernandez, the president and chief executive officer of Memorial Healthcare, and Ebonite Bryant of the AIDS Healthcare Foundation. Thank you so much for joining us today. Glad to have you. I can see Ms. Frazier is here. I'm still learning how to work in this virtual world, so I'm not sure everyone who else is on here already, but I don't see them. But I'd like to start with Ms. Frazier. Ms. Frazier, as we think about all of these things on Dr. King Day, and we think of all these things in a pandemic and the disparities in healthcare, what would you like to say on this occasion?
Well, thank you so much to the Martin Luther King Celebration Committee for the honor of joining this panel, and all the individuals from that are here this morning, including those who are attendees. I think that we are in the midst of one of the most critical pandemics that this nation has ever seen. But before the pandemic came on, there are disparities in general that have plagued our community, plagued our families, and the pandemic brought forth that even more, because there is one in every 1,300 Black Americans die from COVID. And when it was just the first acknowledged that this was a pandemic, what people didn't understand is that it would harm our Black community the most because of our comorbidities. So what I want to share with you to start out as quickly as possible is some statistics in general. 1 in 7 Black children suffer from asthma. 1 in 13 Black adults do not go to see a doctor or a hospital because of the cost of that care. 1 in 90 Black babies will die before their first birthdays. And 1 in 2,000 Black mothers will die while pregnant during childbirth or shortly thereafter. Now, what attributes to that? How does the inequities in health attribute to that? It attributes a lot. Our previous panel talked about the issues of simply having empathy, the implicit bias, acknowledging that when people come to our health facilities, that those are things to the forefront that we should be acknowledging. And sometimes there is the misperception that human beings that are doctors who serve, who vow to serve and do no harm, do have those implicit bias. I want to give accolades to the Urban League and Dr. Ba, who put together this report that I still find phenomenal. It was the State of Black Broward, its health report. And in that health report, we still see the same challenges. Those challenges are that Blacks are 2 times likely not to visit the doctor because they can't afford it. 40% of the Black and Brown community lacked insurance. Black teens are 2 times likely to be overweight or obese. And in those situations, when you are obese or overweight, you're dealing with the diabetes. You're at high risk for diabetes. And one that has really brought out the pandemic is suicide. people who are most likely to commit suicide. So I think that this topic is far beyond needed, and finding the solutions to address those are most important. I think that some of it, what we need to do is start it off is look at the system right now as it exists. And it may require dismantling, not the organization, but dismantling how we address the disparities. And these disparities being addressed through partnerships, through community involvement, through some of our philanthropists, for some of our organizations who want to put that investment in our communities. So I think that that's where we are now. I can tell you a little bit about what Broward Community Family Health Center does. We are a safety net provider who provide those services.
Yes.
So I know there's other.
That's amazing. And so many organizations like yours, Ms. Frazier, has happened to bridge the gap. But I want to make sure we introduce everyone on our panel.
Yes.
And you had such a powerful opening. Thank you so much for that. And we're going to come back to you. I'd like to go to Mr. Aurelio Fernandez, who's the president and chief executive officer of the Memorial Healthcare System. Mr. Fernandez, your healthcare system has been in the forefront of all of this. You were one of the first people to really do aggressive testing throughout the county for COVID. And now you're distributing a vaccine. With this next administration coming in this week, we're assured that the ACA is going to continue, maybe even an improved version of the ACA. How would you, as looking at such a big healthcare system that's a powerful part of this community, what solutions are you looking at to kind of help these disparities? Because it has been pronounced now more than ever.
Yeah, well, before I start, I'd like to thank Commissioner Holness for inviting me to this meeting. I'd like to share with the group that it was under his leadership during the summer when we were under a huge surge of COVID-19 that he was able to convince the different municipalities in Broward County to adhere to the CDC guidelines. And as a result, we saw a much lower number of positive COVID going into our hospitals because the healthcare system was being stressed to the limit. So thank you, Commissioner Holness, for that. And I think this audience needs to know that it was through your leadership. We were very fortunate to be in a situation where Memorial Healthcare System was the recipient of the vaccinations of the Pfizer with 19,700 doses, and we were required at that point to share it with 5 other hospitals in the immediate area, one of them being Broward General, Holy Cross, Cleveland Clinic, Westside, and Florida Medical Center. Through that initiative, we have already vaccinated 15,000, and I know that through other venues in talking to Broward County and Bertha Henry, that we're opening additional drive-through sites for the purposes of vaccinating as many people, as residents as possible. We need to also recognize that the challenges that we have are driven by the federal program. It is not a state issue. We're not getting the vaccines to the state that we're committed to. And as a result, we're all being victimized by not having adequate supplies of vaccines. The state has been extremely accommodating to provide us with the second doses once you initiate the initial vaccination, but we need to continue to receive more than what is coming down, which is 170,000 doses for the whole state of Florida. Now, you made reference, Neki, on the Black community being disadvantaged. Memorial Healthcare System is a safety net healthcare system. We care for every resident of Broward County, regardless of their ability to pay. It is not an issue of economics, but the social determinants that drive why you have a higher percentage of African Americans utilizing the emergency department. You have diabetes as one of them, sickle cell. These underlying issues cause for an increase or an additional number of African Americans utilizing healthcare. But I'd just like to remind everyone in this call that Memorial Healthcare System, as a safety net hospital, will care for everyone regardless of the ability to pay.
Thank you so much, Mr. Fernandez. And I have been patient at Memorial Healthcare System several times, so I know the level of care that you provide, the care and compassion of all your providers. This has been a trying year, and I know it has been a trying year for you guys, and you're still fighting on the front lines. I'd like to invite Ms. Faith Simone-Hunte, Director of Employee Relations at Broward Health, to chime in, our community health provider here in our county health provider here in the county. Ms. Hunt.
Good morning, everyone. Thank you,
Morning.
Neki, for introducing and for having us as a part of this. Thank you, Commissioner Holness and the Martin Luther King Celebration Committee for having us as a part of this integral opportunity, not just to celebrate the life and legacy of Dr. Martin Luther King, but also to engage in transparent dialogue in order to mitigate these disparities in our healthcare infrastructure. So thank you all for that.
Okay, great. Well, how would you like to contribute to this conversation when you talk about health disparities, and especially like you just heard Mr. Fernandez said, for many people, prevention is not an option. They come to the emergency room. That's not a sustainable model for any healthcare.
You know, one of the things that we have seen as a healthcare system that caters to the underserved population is with the implementation of telehealth in for providing care in a socially distanced platform. What I think our healthcare organizations have failed to look at is the access of our underserved population to participate in these telehealths. You know, they have to be able to provide blood pressure, and basically do those types of checks before they log on to these platforms. And not everyone in our underserved communities has access to that. And so as an organization, Broward Health has ensured that our community health sites and our urgent cares and so on have been made, are available for on-site visits to that particularly to that population. As Memorial stated, we are also a safety net hospital, and so we see our patients regardless of their ability to pay as well.
Yes, thank you so much. I'm going to go back to Ms. Frazier because you talked about how you continue to bridge the gap. Talk about the work you're doing in the community and something you'd like to see done more by the bigger systems. You need to unmute your mic, Ms. Frazier.
Thank you
Thank
so
you.
much, Neki. Yes, well, we too are a nonprofit safety net health organization, and we see all patients, regardless of their ability to pay. We turn down no one who comes in. We also were recipients of the vaccines, and so we are an integral part of the in serving throughout through the pandemic. Well, some of the things that we've been doing to try to address more specifically the areas of obesity, we've adopted a focus on a program that we call EPIC, where we are more involved with the social determinants of health of our patients, more specifically in the area of food insecurity. So where our patients who are suffering from diabetes may need assistance with purchasing fresh fruits and vegetables through a partnership that we now have with Humana Foundation, we are able to provide them with a cash card to purchase those fruits and vegetables. Certified dietitian that works with all of them that participate in the program. And one of the areas most specifically involved is those of social isolation with the pandemic. It's providing that mental health counseling and discussion with our patients now, that when they are diagnosed with COVID, that they are able to speak with someone, be it telemedicine. So we also do virtual visits, but if they need to come in person, that's available to them as well. And we found that there's a lot more of our community that are suffering from the fact that they have to isolate, and what that isolation means to their family and the impact of their family. What I'd like to see us do in the health in this integrated system of care and health in Broward County is that we are more connected than we are separate as organizations. There are many, we could reach far more individuals if there was more connections in what each organization do when it comes to providing services to the community. And I don't call them underserved population. I think anyone in the community that has a health disparity is adamant to come, are welcome to come into our system of care, but that we're not duplicating services, overlapping services, and overutilizing resources that could be to somewhere other places of health within the community.
Yeah, thank you so much, Ms. Frazier. And I'm glad you brought up the topic of mental health. As we know, I mean, and it, sometimes I think traditionally in many communities, you don't think about mental health till they're ready to put you in a straitjacket. But through this pandemic, I think everyone will agree that we've started to talk more about, trauma at home and anxiety and all of these other issues. And I want to put this out there to both people, both Ms. Hunt and Mr. Fernandez. Is telehealth making preventive care more accessible? Because I think anyone listening to this from the community that may not have be fortunate to have a primary care physician, or may not be able to leave their home, is telehealth making preventive care and consultations more readily available?
Oh, yes, if I may take that, it's absolutely telehealth. It's unfortunate that the pandemic has really been the impetus for the use of telehealth. It has just grown exponentially, and in mental health, it's very applicable to the level of interaction between physicians and patients. So yes, telehealth will be the fundamental change when it comes to healthcare going into the future, and it provides access to everyone in a very easy way, without having to get in an automobile or having to take time off work. You can do it from home. You can do it at any time of the day. So yes, it is an integral part of the way that we're moving forward into the future.
Yeah. Absolutely, I agree with that. Telehealth has not only increased our patient counts and volumes, but and our ability to care for individuals that perhaps, especially in our minority Black and Brown communities, that may not or are less likely to be able to take time off from work in order to attend a appointment. And so they have been able to log on through our telehealth options and provide and receive, the care that they need. So it is unfortunate that it took COVID to take us to this point, but absolutely it has improved the access for our population that we serve.
Listen, COVID has been a revelation for everyone. I mean, it took COVID to get a lot of people walking in my neighborhood. I have people I didn't even know existed are now walking around. As you know, we all know our neighbors, right? It's like after a hurricane, you see everyone. Just to let everyone know, this is your panel discussion. Please put questions in our Q&A area or our chat, and we will get to them and get them to these folks there that are helping us. I mean, I know that there's so many people that there are conversations about the vaccine. Ms. Frazier, you told me you have access to the vaccine. How many areas are now vaccinating people around our county?
Well, within our system, we have 4 health facilities throughout Broward, in Pompano, Lauderhill, West Park, and in Hollywood, where we are taking appointments to vaccinate. We still have appointments available today. If someone wants to get on the schedule, we are, of course, mandated that we're following the executive order of those who are 65 and older, or our healthcare workers get access to the vaccine more immediately. So we are available for them to do that. One thing, if you don't mind, Neki, me mentioning, is our adolescents, our children who are doing virtual schooling at this time. They also have challenges with they're having their own issues with anxiety and depression because they are at home. So we've instituted what's called hashtag talk to someone, or showing those signals. So we have behavioral health team that also has been focusing specifically on adolescents and through as they go through this pandemic, because sometimes they don't talk to us about what they're feeling and having to sit in front of a computer all day to do their classwork. But yes, between the children and mental health and the vaccines, I think we have our work cut out for us. But I know that all of our systems of care are up for the challenge and willing to do more as needed.
So glad you brought that up. I have a 13-year-old. She has struggled in this, and I have tried to lead with empathy and kindness. I'm a Caribbean parent. That does not come easy to us, but these are unprecedented times. I have a question in the chat about telehealth. There's Mr. Donald Cleveland asks, what about families who do not have access to technology to accommodate a telehealth session? I mean, don't you simply, like at the base level, need a phone? Not just, it doesn't have to be a computer?
Yes. Yes. So we do have, well, I don't want to get ahead of my other panelists, but we do allow, we do some of the virtual, our virtual visits are through Zoom. So we're using 2 platforms. And so if you can do Zoom just to get on this discussion today, you can also have your virtual medical visit be done via Zoom. So if you have a telephone or, of course, a cell phone that access that app, it's not necessarily done through just a computer.
All right. Ms. Hunt and Mr. Fernandez, this question's for you. I'm gonna put you on the spot. They're like, do you think we'll get back to normal by January 2022? Or when do we hope to see, and will it ever be back to normal? I mean, I don't think, anything, we're always going to have like telehealth. Well, thank goodness. There's always going to be some things that are virtual, which actually allows you to include more people. And I think that the cleanliness level of all our public spaces have hopefully changed forever. And I enjoy that.
Yeah, I think it's a function of the percentage of the population that gets vaccinated. As you know, there's a priority list right now, which is residents of long-term care facilities and ALFs, healthcare providers, and then 65 years of age and older. The state of Florida right now, the governor is emphasizing 65 years of age and older. And now we're also going into underlying conditions for those who are obese and diabetic, which are more prone to getting the virus. Not until you get a predominance of the younger folks who do not really adhere to social distancing and wearing masks and everything that the CDC has set forth, that we're going to see a change in the curve. I don't know if it's going to be in the summer or by the end of 2021. It's a long journey. The most urgent thing is to get the vaccines to everyone who needs it. And the quicker we go about this, the better. And we need more venues. We can't just depend on hospitals and drive-through sites. We need Publix, CVS, Walgreens, even physicians' offices. We need to move forward. Now, Johnson & Johnson will be coming out with their own version of the vaccine, which is only 1 dose instead of 2 that the Pfizer and Moderna require. And also the Johnson & Johnson does not require the refrigeration, the freezer temperatures that the other 2 require. So not until you have more access to the vaccine will we see a curve. But we will pray that this is by the end of this year and gets them back to normal. The impact on the economy is huge. You're seeing family members being infected, and it's just it's very disruptive. What can I tell you?
Listen, I know know that you've had a lot of sleepless nights. Ms. Hunt, how do you feel about how everything is going? What would you like to see happen? And we're going to start to wrap this up. And this is so important because we could talk forever. But go ahead, Ms. Hunt.
Absolutely. So in addition to the access to the vaccines, one of the things that we have to look out for as a community is also the regaining the trust and reducing that fear of our Black and Brown population, right? There's a certain fear towards receiving the vaccination. And so I think the more that we do to educate our populations that we serve with the information so that they can make informed decisions and get the vaccinations through all of these sites that we have available locally. Broward Health started off on our premises and has since expanded to the former Lockhart Stadium in order to be able to meet the needs of a larger population. And so, you know, I think our local community organizations are committed to ensuring and following through with this. And so, you know, it's just a matter of community leaders or elected officials coming together, putting the messaging out there to our populations that, you know, it is safe, and, you know, how they can, the information regarding access to the vaccines. I would
All right,
like
thank
to,
you so much. Go ahead. I'm sorry.
I'm sorry. In addition to that, you know, we also have to address the concerns that I think was brought about in the previous panel, you know, of the perception or potential for bias in the care that we're providing to our communities. And so, you know, investing resources in training, you know, as well as the access and opportunity for those individuals to receive the care that they need is essential.
So important. Thank you for punctuating that, Ms. Frazier, Ms. Hunt, Mr. Fernandez. We appreciate you joining us here today. I want to say from the bottom of my heart, thank you to all your employees and all the things that you've had to do over the last few months. I want to encourage the community to continue all those CDC guidelines that Commissioner Holness has talked about constantly. I know in his dream, he hears mask up, social distancing, use hand sanitizer, wash your hands. It's like having a toddler all over again, right? But we can't say it enough that human behavior has been most important in all of this and continues to be, even after you get a vaccine. We want to thank our healthcare panel. Coming up next, going right into what Ms. Frazier was talking, we're going to talk about education. We have some really great panelists. I want to thank everyone here for joining us. Calvin Hughes is going to moderate that one. And I think right now we're going to throw it over there to some entertainment by Plantation High School.